Hello, hello, hello. Assalamu alaikum. Good morning. Khushamdi. Jiayanu. Goedemorgen.
Pakhair Ragale, Ni Hao, Chune Shumme, Washmale, Ohio, Gonzaimes, Guten Morgen, Hola, Bonjour, Privyet, Kaifa Hal, Hale Shamat Chatore, Ahlan Wasalan Marhaba, Buna, and a very amazing good morning to everybody who's tuned into PTV World and watching World this morning alongside the very amazing, the very talented Shiza Hashmi and Shahzad Khan. Hello Shiza, how are you today?
I am absolutely great. How are you?
Well, I'm absolutely perfect. I'm doing better too as well, ladies and gentlemen, and I think I'm very happy as well.
Okay.
And that's because of the reason that I'll be, just after the show, I'll be leaving for Lahore too as well,
Oh,
because
yes. Tell
one
us
of the
about that.
biggest food festival, ladies and gentlemen, is taking place in Lahore, in Lake City on the 16th, 17th, and 18th of November. Please make sure that you come down to enjoy,
And
or
you're hosting
probably,
it, right?
yeah, I'm hosting it too. I didn't want you to say it. I just wanted to be a
You're
little
just being
modest.
modest, yeah.
Well, thank you very much for that. But you can spoil your taste buds with a lot of amazing food, and you can spoil your earbuds with a lot of loud music, because a lot of international, national musicians will be performing, while I'll be giving you a little bit of hint of, or a pinch of humor.
Well, that's great. You know, if and only if I didn't have work on my weekends as well, I'd absolutely make it to Lahore. But for all of those who are already in Lahore or in adjoining areas, you should go, because I assure you it is going to be one of the best events.
Exactly.
Well, before we move on to introducing the topic what we're talking
Yeah.
about today, I don't know if I should say this, but I know that you underwent a back surgery.
Yeah, yeah, yeah.
And for that you went to the UK.
Yeah, yeah, yeah.
Why did you go to the UK, and why did you actually feel the need that probably, you know what, these are the, all the conditions that were probably more suited to be treated in the UK and not in Pakistan?
Okay, so unfortunately over here in Pakistan, we talk about technology every day, and technology is evolving and it's revolutionizing the world too as well. So as a matter of fact, I had a disc prolapse in my backbone at L4 and L5 areas, and it was very bad. It was so terrible that my leg wasn't working.
Okay.
It was numb all the time. I was walking not in a very straight line. So my body posture was deteriorating, and it was pain 24/7. And so after consulting all of the neurosurgeons over here within Pakistan, there was this only one solution, and that solution was to actually, give you like 18 stitches at the back, go down and, probably scale off your, I don't know how the apparatus might work, but to me, it was very, it looked, or the way the doctors were explaining, it was unbearable.
Right.
And then,
Are you sure?
there were no 100% chances of cure too as well. And
complete
we
recovery.
weren't sure of the fact whether I'm going to get better or not. So this is why we researched and we got to know about keyhole surgeries, which is actually the newer trend with backbones or probably brain and all of these other things, where they really make a small hole, go inside, cut it and then suck it out. Very simple, very costly. Thanks to Allah Almighty that we were so privileged that I could actually afford that. But other than that, I think the point you're trying to make over here is about why are we actually evolving in terms of technology where it comes down to surgery.
Yeah, I mean, I personally want to ask, weren't you frustrated of the fact that you had to travel so far away?
Yeah.
And it's
And
great
I had to
that you
wait for
mentioned-
6 years in all of this pain.
Exactly. And I cannot even imagine the pain you went through. And you just mentioned that you were privileged enough, alhamdulillah, that you actually had to.
Yeah.
But there are like millions of people, even in Pakistan, not only across the globe,
Exactly.
who are not able to afford these surgeries. Not only the back surgeries we're talking about, but even heart surgeries or minor most surgeries.
Yeah.
So shouldn't this be a part of basic healthcare?
And thank you very much. I think you've hit the nail on the head too as well. This is what we were talking about, ladies and gentlemen, because 17 million people actually do not have access to surgeries or to the healthcare facilities. And not just that, out of them, 16.9 million people die. So I think that it's a point of great concern, and I think people actually need to step up, and the public-private partnership will definitely help building a framework where it will be accessible to everybody. Now, having said that, it's not that easy, ladies and gentlemen, because it's not just Pakistan where we talk about 17 million people. The global population is more than 7 billion people now. And we want everybody to be healthy, but that's not what the case is. 5 billion people do not actually have access to hygienic surgeries or
Imagine
probably
that.
healthcare system too as well. So I think it's a global problem, and coming down to the point where World Health Organization actually passed a resolution in 2015 where they said that surgical care is actually a part of your health too as well. So after that, I think every nation stepped up and they wanted a plan where they could actually implement some kind of framework where it was accessible for everybody,
Yeah,
which
and
is
they
why
could incorporate the both.
which is why I'm going to mention about Indus Health Services. It's a there's this Indus hospital in Karachi too, but there are 12 hospitals running under this umbrella. and they give surgeries to people for free. Obviously not cosmetic surgeries. If you want your lips to be bigger, that's your problem. That's
You'll
not
have
our
to pay for
problem.
that.
Yeah, so you'll have to pay for that. But other than that, so they came up with this initiative where they actually called in experts from all over the globe.
Okay.
And on Thursday, which was yesterday, ladies and gentlemen, there was this conference which was titled as National Vision for Surgical Care. And they wanted all stakeholders to be a part of it. May it be the government, may it be the private sector, may it be anybody who can actually be of some help. Now, what is happening? You know, what happened within the on the first day of the conference? This is something which we'll be asking. But other than that, how are we going to save the life of 5 billion people in a matter of short time? Because if we talk about sustainable development goals by 2025, ladies and gentlemen, we talk about poverty alleviation, we talk about clean drinking water. So all of these may probably be playing role in you getting sick and getting to a point where you actually have to get your surgery done.
Exactly.
But not just that. There's one more thing, and that is that over here in Pakistan, you know, for example, when I was going for my back surgery, thank you that you mentioned. So my grandfather was of the fact that you should never ever get a back surgery done. So that means that you'll be living with that condition for the rest
For
of
a
your
lifetime.
life, and you'll be handicapped after a while because the doctor's
God
telling
forbid.
you if you do not get your surgery done, you know, your leg's not going to work.
Immobile
So
labor,
imagine
yeah.
how many people are out there living in pain. We want you guys to not live in pain. We want to give you relief, and we want to give you happiness, because smile is the best curve of the body.
Absolutely.
So this is why you'll have to listen to what our guests have to share with us today. So on my right-hand side, ladies and gentlemen, we have been joined, but we're very kind, we're very lucky, in fact, and we're very thankful to our very amazing guests who've actually made their way from all the way from US, and he's the professor of global surgery. He's from Harvard University too as well. He's none other than Dr. John Miara. Hello, hi, how are you? Assalamu alaikum.
I'm great. It's great to be here.
Thank you very much
Our
for
pleasure.
joining us. And alongside Dr. John Miara, I think the brain behind the entire concept, ladies and
Who
gentlemen.
was modest enough not to accept that she was actually the brain behind it, but
Yeah, so she's a pediatric surgeon. She's none other than Dr. Lubna Samad. Hello, assalamu alaikum, how are you? Thank you very much for joining us. And last but not the least, ladies and gentlemen, he's from Harvard Medical School, and he's none other than Dr. Alexander Peters. Hi, how are you? Assalamu alaikum.
Good. Thank you so much for
Thank you
having
very
us.
much
It's
for
great to be
joining.
here.
And you know, this is what happens. This is how my life is. So if I'm going to meet an American, I think my accent all of a sudden turns American. So this is what happens, and it is very tricky too. A lot of my people after watching the show tell this to me too. But Dr. Lubna, I think we're going to get the conversation started with you. First of all, let us know about the Indus Hospital Network or the Indus Healthcare Services, and then what are they doing, and about this conference which took place on Thursday. And we're sorry that we are making you a bit late for today's conference too. Yeah, go ahead.
Thank you so much for having us here. Shahzad Shiza, essentially, as many people know, Indus Health Network started in 2007 in Karachi as a single hospital.
Yeah.
The point behind setting up this hospital was that when people need health care, it's often out of their reach.
Okay.
Because it's too expensive. You know, there are many people living in poverty in our country, and accessing
Loads of poverty, man.
loads of poverty, and the government health system is doing its best, but it is overwhelmed. So, you know, as always in Pakistan, and that's one of the remarkable things about this country, is the way people step up to fill the gap. And I think Indus was just one of many examples of people who've stepped up to fill the gap. And the reason why surgery was given importance from the beginning was the realization that when a person needs surgical care, it is a bigger financial hit all of a sudden.
Yeah.
So, you know, if you need a bypass surgery, you don't have the money, most people don't have the money to
immediately
pay
go
for
for
that.
it, right.
You know, as opposed to that, if you are a diabetic and need to go and see a doctor several times in a year, that cost is spread out and therefore more bearable. The one hit that surgery gives you made it impossible for many people to get surgical care in a timely way. So that was one reason why it started. It just so happened that the founders of Indus were 4 people, 3 surgeons and 1 anesthetist.
Okay.
So you know, that was, they had seen this firsthand, and that was the motivation behind it. And alhamdulillah, over the past 11 years now, Indus has grown to work in not only in Sindh but in other parts of the country, where we are partnering with the government in setting up district and taluka level hospitals,
And they're
as well.
cooperative.
Yeah.
Fantastic. I think the government all over realizes they're really trying. But there are so many constraints, both budgetary, their ability to manage a population that is just growing, and the fact that we are now no longer able to say that, oh, we can't do a bypass or this or that, because these are available elsewhere in the world.
Yeah, right.
So you want it for your own people.
Absolutely.
So while the poverty is increasing, the need for surgery is increasing as well. So that's a difficult gap for the government to fill alone. And that's where Indus and many others have stepped in to try and help.
Well, that's great, and which is why that I want to actually ask about this, collaboration in between the Indus Health Services and the National Health Services regulation and coordination. And are we on the same page? Because I think that the President of Pakistan, Dr. Arif Alvi, is said to be attending the conference too as well.
Well, let me answer the last bit first. We were hoping he could come, but
Okay.
he had a scheduling conflict because of which he's not been able to
Alright.
make it. But we are very pleased that the government has been well represented at this forum.
Yeah.
I think there was a meeting that we held in Geneva in May this year. John was there, Alex was there as well, and people from the World Health Organization, other international stakeholders were there. And they were really there to talk to the person leading the Pakistani, or one of the members of the Pakistani delegation, Dr. Safi Malik, who's at the ministry, Federal Ministry of Health, who wanted to hear about this from us. And we know that the national surgical planning process has happened in other countries, predominantly African countries, and we wanted to see if this could be done in the Asian context as well. And Dr. Safi was there, and he met with about 8 or 10 of us there, and his enthusiasm was just amazing. He understood the need, he caught on, he was responsive, and by the time I reached Karachi from Geneva, he had already called me up and said, when are we meeting in Islamabad? So, to answer the question, and we've been working with the government for past 6 months, and they have made things move.
Amazing.
So in less than 6 months, we're all here.
Wow, that's
International and national stakeholders from all 4 provinces, all provincial health departments are represented, and over these 2 days we are trying to see how Pakistan can step up and talk about surgery in a comprehensive and in a cohesive manner.
Thank you for saying that, Dr. Lubna, but it's such a great initiative. But I want, Dr. Alex, probably you could answer this. Why did it actually
Short
take...
forms are coming out.
They were all mentioned. I'm sorry, Dr. Alexander. So, it was not until only 2015 that they actually recognized surgery to be a part of basic healthcare. Why did it take so long? It's been thousands of years that people have been needing surgery. Why was it 2015 that they actually recognized?
Well, that's an excellent point, and something that we struggle with every day. And one of the things that we really focus on at Harvard Medical School is how can we bring surgical care to people all over the world. And there are a lot of health priorities. There are a lot of needs. HIV, malaria, tuberculosis, things like that have affected people for generations as well. But surgical care is an essential need as well. 1/3 of the global burden of disease at some point involves surgery. People all over the world need surgery. As you said, there are 5 billion people around the world who don't have access to surgical care. And when we talk about surgery, we talk about a few things, right? Emergency and essential surgical care is things like trauma from road traffic accidents, which affects young people more than anyone. Things like obstetrics and maternal care. So when women die in childbirth, that has to do with lack of access to obstetric care. And anesthesia care, because safe anesthesia is an important and critical part of surgical care. And those 3 things come together really make this perfect combination for high quality surgical care. But it's taken time to get the world on board with that, and we're excited now that we're making so much progress.
Well, it's great that you said that. One of the points that you mentioned was pregnancy-related surgeries. And actually, I myself have witnessed this in Pakistan in so many areas that, of course, due to lack of resources, probably due to lack of availability of doctors especially, or, basic health care, that mothers are left to die right after they've given birth to the child. And then the child is, left to live a lifetime without a mother, without a support system that is so essential. So what are we lacking? Is it the resources? Is it we're not able to manufacture those things within Pakistan? Is it because we lack doctors? What is it? Any one of you can answer this.
I think it's the technical support. So let's talk about that.
So why is there this limitation in providing surgery? Well, I think it goes back to the question you had asked Alex. Decades ago, people thought surgery was just too expensive, and it wasn't something that we should spend money on. So we should spend money on the things that seem to be cost effective. But what you find is that health systems don't work if you only invest in certain parts of the health system. So it's as if you had a car and you only bought certain parts of the car. You bought a wheel and you bought a steering wheel and you bought pistons. That doesn't make the car run properly. And so now governments are starting to realize, you know what, we need to invest in the whole automobile. We need to invest in the whole health system.
Yeah.
And so that's what's, there's really been a cultural change and an understanding that health system strengthening is what is important. And that includes OB care. So, we're not going to reduce maternal mortality without, improving surgical care, because C-sections are a surgical procedure. You need nurses to take care of surgical patients. You need ICUs.
Right.
You need community health workers to take care of patients after. So you need the whole health system to function properly in these settings.
Exactly, and you might not be aware of this word itself, but I think over here in Pakistan we're very used to of the fact that we jugadify a lot of things, So jugaad is probably, that you didn't actually find the right brake pads for your any model of car, but what you did was that you actually took someone else's car's pads and put it into yours. So I think that we need a lot of technical support from World Health Organization too as well, which is why you guys are here. So please shed a bit of light in which areas are we actually expecting technical support from World Health Organization.
Well, one of the emphases for this conference actually is how can the World Health Organization work with countries to plan all of their surgical care for their countries.
And that's my emphasis too.
Right. So, it's really important for countries to prospectively plan. You're not going to be successful if you don't take a look at what is our infrastructure, what does our workforce look like, what type of surgery are we performing now, is it safe surgery? So without a thoughtful approach, you're not going to be successful. So in terms of the technical support that Harvard Med School and WHO are offering, they're working with countries to take a step back and say, why don't we form a strategic plan around surgery, obstetrics, and anesthesia?
Yeah.
Okay.
That's great. So this is why you're going to come in and let us know that where are we right now?
Well, I think we have a great start because the National Health Vision document, which is National Health Vision 2025, that was prepared by the Federal Ministry of Health with the provincial health departments on board. And that was recent, I think 2 years ago that was signed off. That's a very well thought through document. It recognizes that there are, I think it's important to know that the government as well as all of us recognize that there are challenges. There is a shortage of health workforce. There are obviously financial limitations. There are expertise challenges as well. Again, you start off by acknowledging that there is a problem and we're well on that start. I think this national vision for surgical care is important because in the national health vision overall, the communicable disease component is very clearly laid out. And then we talk about non-communicable diseases as well. But nobody mentions surgery separately. Now, surgery is interesting. You see, there are some procedures that are pure surgery, like what Shahzad had, a regular hernia operation. But then there are other surgeries that are actually part of communicable diseases. So for example, if there is somebody who has had a typhoid and a perforation after that, and they need a surgery, they need a laparotomy right there as soon as possible, that's when surgery comes in. If somebody has a non-communicable disease, like coronary artery disease or diabetes, they often have heart attacks, for which you need a coronary artery bypass graft or a bypass surgery, as we all say. Now, that is surgery again. So what's important to know is that surgery, while being a specialty itself, is a part of the management of many other diseases. And that is why I think Alex quoted that very important figure, that about a third of all medical conditions require surgery at some point or other. And that's a huge burden. So we're well on our way in recognizing it's a problem. I think the National Vision for Surgical Care hopes to say very clearly that surgery, I think it's implied but not clearly articulated.
Okay, but there's one more thing, very sorry, and that was that since you were mentioning about surgery, and I think there's one thing which we need to keep in our heads, and that is that we are in Pakistan. And we are in a country where people want to avoid surgery as much as they can. And it's not just about money, but they don't want their body to be slit open.
The mentality we tackle with.
Yeah. So I'm talking about the mindset. So, so we can have the vision, we can have all the policy making, we can have all the documents and all the conferences, But if somebody is not willing to get a surgery done, what can we do about it?
I'll tell you something.
Yeah, sure.
Right? I have been a frontline health provider in Pakistan for most of my life, well, adult life, right? I've trained in Pakistan, I've worked in the government sector, I've worked at the Indus Hospital, where we meet people from all walks of life. And when people need surgery, they want surgery done. Usually the problem is that there are long waiting lists, they don't know where to go, they can't afford good care, they're nervous about the quality of care they'll receive. That, they've heard somebody say, usually why do they not want surgery? Because they've heard that somebody had a back operation and lost their function, or somebody had a hernia operation and
it went wrong.
And it went wrong.
Right.
So they're not scared about surgery itself, they're scared of the harmful effects. And I think it's important for surgeons, like all other doctors, to be able to communicate that. So we do have people who are fearful, and they have to be talked through. I'm sure there are some people who don't make it to hospitals. But unlike, and that is why we're talking mainly about essential and emergency surgery. We're not talking about the lip job or the nose job here. We're talking about what people need. And one of the problems is that for many, many surgical conditions, the reason why people will come to you is because they are in pain, their body's hurt.
Right,
They want that sorted. So I'm sorry not to agree with you on that, but people want surgery. We are not being able to meet that challenge.
Well, yeah, it's great that you said that.
Dr.
but again-
Alexander, what do you know?
Just to build on that, I think it's a really interesting question. Why don't people access surgery? And there are three reasons that we focus.
Sure.
They can't afford it, which we've talked about. They are worried about the quality; it's not safe, or they can't get there in time. That they're not close enough to a surgery, or they're not close enough to a hospital where they can get surgery. And so, if you mentioned that big figure, 5 billion people around the world don't have access to surgical care, and there are a lot of people in Pakistan who don't have access to surgical care as well, and it usually comes down to one of those three reasons. So the National Vision for Surgical Care looks to break down some of those barriers, because I think there are a lot of people that will really come out of the woodwork, so to say, and try to access surgery if they can, and it's really a lack of access to care that's
I'll add
keeping
something to
people.
what Alex is talking about, the affordability. 81 million people every year are impoverished seeking surgical care. That's just not right. So there's a social justice and health equity component to surgery that we shouldn't be doing that to our population.
Yes.
Right,
All
absolutely.
And that makes people afraid of seeking surgery because they say, I can't afford it. So that's something that has to be woven into any national plan.
But there's another side to the picture, and that is, I'm very sorry that I'm bringing this in, but I always do that too as well, and I warned you about that.
Yeah.
So last year I was traveling with my 4-year-old daughter to US, and I was in Chicago at that time. So, and all of a sudden, because she's my first daughter, first kid, so I was very worried. So her nose started bleeding, rushed her to the hospital, and it took her 15 minutes, to settle her down, and everything was cool. But as soon as the check comes in, it was like $1,400. So, I mean, how do you think people are even thinking about surgery in United States of America? Let's talk about that too.
I think here,
Well,
here comes in
boy,
the health
I don't
You're
think you
insured,
wanna go to
I
the
hope.
US system.
No, because
We're spending 20% of our GDP on healthcare.
It's not because of the fact that I want to have a comparison, but it's because of the fact that people over there get more surgical help or surgical healthcare over there. But to keeping in view where we are talking about people do not have this money, and these are the three most common factors. So that means it probably is applicable for you too, as it is to me. So I just wanted that. So
Well,
what kind of solutions do we have?
So I'll be the first to admit, in the United States and in some other high-income countries, there's oversupply of procedures. So we certainly wouldn't be advocating for that. I think there's a mid-level number of procedures that a country should need, and I think the U.S. has certainly surpassed that. And you bring up the other issue around insurance, and Shiza and I were talking about this earlier. How do you insure a population? Every country's different, and so this plan isn't meant to tell any country what to do. Some countries, they have a form of government-paid insurance. Some countries are using cell phones now for microinsurance. So there are going to be different solutions in different countries for how to pay and how to prepay for.
Thank you very much for saying that, but there's this funny part to it. So after a week, I had an irritability on my skin as well, so I had to go to the hospital again, and they charged me $1,600.
Did you have
so I
some
left my
money
family
pocket?
back there and came back so that I can work and send them more money. So I think this was the best part. But other than that,
But
you want to go ahead?
since you just mentioned health insurance and how sometimes the government, it works on that. So a few years back, my dad had to go through a bypass surgery. And I will be honest, at that point in time, we were not able to afford that if we had to on our own. But luckily, he was an army officer back then, so the government was, of course, paying for that. But we were privileged again, alhamdulillah. Hundreds of thousands of people in Pakistan belong to the downtrodden segments of the society who cannot afford this. And I think here we come to you, Dr. Lubna. Yes, in this hospital does that. But when we're talking about Vision 2025, is that going to be supportive to all segments of the society?
Because the growth is stunted, people are malnourished, there are a lot of problems. I think every Pakistani needs a surgery.
Well, I hope every Pakistani won't need a surgery.
Yeah,
That'll
yeah.
just add
But
to
what if
the
they
to the
do?
burden. Well, I
60%
think the
of the
idea
population is
No one
malnourished.
deserves to die in pain,
Yeah, yeah.
right?
no, of course, of course. I think the aim is so. The reason why international stakeholders and you know, people like John Walt Johnson from WHO is here in Pakistan, and he's at the conference now, and many others who have supported this initiative both in Pakistan and other countries, is recognizing that there are some surgeries that are essential or emergency. And that is a very important concept because there are certain surgeries that must be made available to a population. Now, this may vary a little bit, but depending on the kinds of diseases more common in one population versus the other. But what it essentially means is that we now have a list of 44 surgeries that have come up through a very thorough academic process by a group known as the Disease Control Priorities that published an edition, an entire volume on surgical priorities. And what that essentially says is that these are the backbone surgeries. And these are the surgeries that must be available. They take care of the more commoner conditions, the conditions that require urgent care, otherwise there will be either loss of life or a limb. And they are the ones that can actually be done relatively easily. So going back to one of the points you made, most of surgical care is not very high tech. Right? You don't need fancy robotic surgery or laparoscopic surgery.
It just feels great, you know. Just to see those technological equipment all around you.
It's
you're like,
there,
okay, I will
it's
save
there,
hands.
right?
Yeah.
But if I have a choice between saving a life and waiting for something fancy, I'd save a life with what I have, right? So we start with the bottom of the pyramid.
And since you said what I have, so I think here all of us should be discussing a conducive environment and availability of resources where we can manufacture our own stuff. So I think we just discussed that few months back, I think 6 to 7 months back, our Chief Justice of Pakistan took so much notice of the fact that Pakistan was not producing their own heart stents, and it was supposed to, which was supposed to be selling at 15,000 rupees in the market.
Yeah, well, you know, it's going to get controversial, so let's not
No,
go
it's
on that
not.
side.
Wait, let me complete
because
it.
there's a reason. I'm
Yeah.
sorry that I'll have to say it on state television, but ladies and gentlemen, I think I'll have to be honest with my own job too, and that is that we actually manufacture a lot of surgical equipment over here in Pakistan, but it's just that we do not label it made in Pakistan. That's what the problem is.
So yeah, so my point being, if we were manufacturing that in Pakistan, it would cost 15,000 rupees. And I'll be honest, local people, you know, every person could actually afford that 15,000. You know, as compared to 0.1 million that is costing right now if we're importing the stunts, let's say. When will we be able to make that? And one more thing, especially when we're talking about child heart surgeries, a lot of people I personally know are opting to go to India or other places. And then again, there are visa issues that you're not allowed to come here. So then again, they don't have access to surgery. So when are we making those things available for them?
She said you've brought a couple of points into the same question.
So
So
let's address
for
them
the
one by
answer to
one.
make sense, right? I think the answer I'll start off by connecting it to my previous, you know, the conversation we were just having, is that surgery in its large part is not high tech in terms of equipment. It requires multiple components to work. It's like a jigsaw, right? So if you have a surgeon who is great, but you don't have a good anesthetist, or if you have a great surgeon and anesthetist, but you don't have electricity, and then you don't have water, you don't have blood available in that place, you don't have post-operative and pre-operative help. You need the good nurses, the good people to help a patient recover. Your father's gone through the bypass, so you know there was a lot of rehabilitation required. So that entire, it's not a one-off. It's not like one person going and putting in a vaccine. It requires multiple components to work together and work together well. And that is the challenge of surgery, right? The stents are obviously an important part of equipment. It's a piece that is required for coronary artery disease and angioplasties. But I think, so I'll address that in a little while, but Pakistan is actually manufacturing surgical equipment, instruments that are world class. So we have that. I think the real problem is when we get the surgical instruments should be made available to the local population, the people who can use the equipment, and then the infrastructure that is there. So when we talk about a national surgical plan, we look at domains like workforce, we look at financing, we're looking at infrastructure, service delivery, as well as information management. We should not only be doing operations, but we should, as a group of people, be able to tell you that out of so many surgeries, these are the complications, these are the mortalities, does this meet international or acceptable standards or not? So the kind of surgical procedures that the DCP-3 is talking about is timely abscess drainage. If you have a fracture, you don't want the person going to a bone setter who does a bad job of it and he's disabled for life and begging on the street. We want a good surgeon able to fix that fracture close to that person's home so that he doesn't have to travel too far and the costs don't add up. So that is the challenge is not the money. The challenge is making that system, many components of which are already present. So filling the gaps where they're not, the gaps are there, and making the components that already exist. We have an excellently thought through district taluka healthcare system. It's just not functioning optimally.
Implemented well.
We will definitely
And then
come
your
back to that,
stents.
how it will function, but there's one more thing which we really need to keep in our heads if you're talking about national surgical policy or if a framework needs to be implemented, and that is that back in 2000 or probably 2001 and 2, so there was this very urgent need or dire need of people who've graduated in information technology. So Pakistan started producing them, and we produced so many that a lot of them cannot even find jobs. So now we're talking about surgeries. Hopefully, we'll get down to that point where people will have access to surgery. But are we even talking about, when we talk about national surgery policy, are we even thinking about pre and post care too over here? I think I'm going to start from Dr. Alexander.
Absolutely. I mean, surgical care begins the minute you walk, even before you get into the hospital. Right? It starts with detecting people in communities and finding out who needs access to surgery and who has surgical problems. And then it comes to when you get into the hospital and the care before surgery, the care during surgery, the care after surgery. All of those things are important because surgery doesn't end when the surgeon finishes. It ends when the wound is healed and when the patient has gone home and is back to a functional life.
Which is why I'm going to come back to Dr. Lubna over here. So this is something which does not happen in Pakistan very often too as well. I mean, once the surgery is done, it's very hard to even find the doctor. He's probably back home sipping a cup of tea. I mean, these are some normal problems. So how do you think that you're actually going to train your workforce? Because it needs a lot of training if you're talking about surgery.
The good thing, again, I'm coming across as an optimist, but
I was about to say that.
That's
No,
nice.
Dr. Lubna, you're okay.
Always
it's
have
great.
to be an scapegoat, but it's all right.
No, it's great that you're actually being an optimist, but you're sort of also ignoring that so many things that are actually happening in Pakistan. Now, the point that you're going to address, I'm sort of going to link to that. A girl I know went through a C-section, that's what we call it, right? And it went wrong. There were so many, things that went wrong with her, and overnight, the doctor flew to the UK, of course, because she knew that she had done these things in a well-reputed hospital of Islamabad, I should not name.
People have towels inside, People have towels, scissors, I don't know what else
So
inside.
this happens. So again, coming to Shahzad's question, how are you training your workforce?
okay,
To be at least generous to the job that they're
No,
doing.
I understand. There are two components. First of all, the good thing is that we have excellent surgeons, anesthesiologists, technicians in the country.
Working only for the rich people, ma'am.
Nay, you'll be surprised. Nay, there are, of course. They can. The way the income is, you're probably paying the $1,400 and $1,600 bills in US with some income.
After
So
saving
at
a year's
some
salary,
So at
then
some,
coming back again to work.
at some point, we do understand that there are privileged people and there are doctors working in the public sector. But there are many, many people in Pakistan, doctors across the board, who are working in the socially deprived sector, and they're really working hard. My point is not where you're working. My point is that we have, within the country, we have the expertise to train our people. There are good training programs in most countries, in most university hospitals across the country. The important thing is, but what you're talking about is the quality of care, right? So we understand and we recognize wherever we ramp up quantity, we have to in parallel work on the quality. You have to have ways of monitoring. So that is why the data is so important that I was talking about earlier. What are the complications of surgery? What is the mortality? Why did those mortalities take place? How can you prevent them happening next time around? So the quality component is an important part of any initiative, and it is certainly, and I'm glad you've brought this up, it is certainly a very important part of what we are hoping to initiate.
You know, let me just add another point too. You're asking some very hard questions, and they're good questions, and governments ask the same questions. Why should they put money into this type of care? And there's a really good reason why they should. When people leave the country, they take money out of the country, all right? When you have a back problem and you're not working, you're not productive in society. There's good economic data that shows that there actually is a return on investment for investing in surgery, and it can be between 6 and 9 times the investment. So when governments start to realize that this is an investment and not just a cost, that's why they start to invest in.
And that too in a country where 60% population comprises of youngsters too as well. So I think that
Exactly.
workforce. But now, since we are running out of time, we have to wrap up the show too as well. So there's this question for you and Dr. Alexander, and that is, that are you actually helping Dr. Lubna over here to help out or to figure out what are the weakest areas where we actually have to work quite a lot, and then which are the areas where we can probably take some help and then make this framework work?
Well, I'll tell you, Dr. Lubna
And then how
doesn't-
was the first part?
Dr. Lubna doesn't need our help, so she can do this all on her own.
No.
But you bring up a really important point. So, you know, our group at Harvard Med School, we are working with various governments to help them come up with their own strategic plan.
And the research is great too.
The research is good, but the point I'm trying to make is we don't bring a cookbook and say this is what you should do. We
enable them to.
We enable them. We're like an enzyme. We're helping them come to their own conclusions and their own decisions. So, and I think that's really important because the decisions that Pakistan makes are going to be very different from the decisions that other countries make, and they should be very different. So that's extremely important. This is a Pakistani solution to Pakistani issues.
Wow,
Homegrown
great,
solution.
Dr. Alexander.
And I think just to get one step beyond that, you know, Dr. Lubna's team really is leading the charge here. It's been phenomenal to work with them, and we've really enjoyed my time here. But in Pakistan, it's provincial. And so as we work on strategic policy, what's really unique and exciting about Pakistan is that we're hoping to enable each of the provinces to take this up on their own. And so, because the needs in Sindh are different from the needs in KP. And so as you do this analysis, and you said, you know, how do we know what's going on? How do we look to find it? We start with what's called a situational analysis. And we say, what are the needs? What are the workforce needs? What are the service delivery needs? And like I said, they may differ by province. And that allows each province to tailor their own plan and their own package to their population and their context. And that's really the most important thing here, right? Is how can we really bring everyone to the same level, but recognize that there are differences. It's a big country and a wonderful country, but there are differences that need to be addressed.
Amazing. Thank you very much for being with us. Thank you very much, Dr. John. Thank you very much for being with us,
Thank
Dr.
you.
Lubna. Thank you very much,
Thank
Dr.
you so much.
Alexander, for everybody who's out there. I think this is the starting point, and I'm sorry that I actually had to be an scapegoat bringing about all the negative points, but it is very essential for
But
all
they needed
those
to
other
be
people,
addressed.
all the think tanks in the country too as well, who are actually working in the same industry or in the same field, to please realize that these are the needs of the hour too as well, and we need to prioritize in the first place, because everybody needs to live peacefully and without pain.
Absolutely. And just before I think we wrap up the show, this is a very small thing we always reiterate upon: be kind to each other without having the expectations of getting a reward.
Random act of kindness, ladies and gentlemen, please make sure that you do them every day.
Yeah.
Shiza, you look good today.
Thank you
I
so
did it. I played my role. But thank you very much for being with us. For everybody who's out there, please do write to us on our Facebook fan page, which is with the name of
Well This Morning.
on Twitter,
Well This Morning without a G.
on Daily Motion and YouTube.
Well This Morning, Well This
and
Morning.
the fabulous repeat's going to be at
11:05 at night.
till the next time. 1, 2, 3.
Good
Good
morning.
morning. Thank you.